I think a shot in the arm has a history now. When you first started, we knew it was good. I had the pleasure and the honor of being one of the first to be on the program. And it just warms my heart that years later, here we are again, enthusiastic about the subject matter and engaging in a really active dialogue. So, for those of you who have not been involved in listening to Shot in the Arm, you're missing something.
Welcome to this very special episode of Global Health Diplomats with a Shot in the Arm podcast, our mothership. We got a lot to cover today. We have the state of the world and what that means for global health. And we also have a celebration of 5 years of a Shot in the Arm podcast, plus a very, very special guest. But I'm delighted to say that I'm joined by Eric Goosby, the nice one.
Well, thank you, Ben. And Ben's the British one, so here we are together once again.
Brilliant. And Eric, who is our special guest? It's someone that we have both worked with very closely. He was the first guest on the Global Health Diplomats podcast. He's been on a Shot in the Arm many times, as have you. So over to you.
Well, thank you, Ben. It's just really a pleasure to have once again Dr. Anthony Fauci, who's a distinguished professor at Georgetown University, is working now as a academic and has moved his entire operation into Georgetown. So we're very happy to have him here. He has been a friend and a colleague for more years than I can count, going back to the early days of the HIV epidemic, but has brought both wisdom and science to the domestic response and the international response through the President's Emergency Plan for AIDS Relief, PEPFAR, that he really had an instrumental role in the foundational decision-making that created the program. So, Tony, it's really a pleasure to have you. We're here with Ben. Welcome.
Thank you so much, Eric, and thank you, Ben. It's great to be with you guys again. It's always a lot of fun and very exciting and productive to spend some time with you discussing so many of these important issues.
Right. Well, and I think, Eric, you got joined by one of your dogs, didn't you? So that makes it even more fun. Tony, as Eric and I were just getting you set up, we both noticed how relaxed and how young you look. How is retirement treating you? What are you up to now that you've retired from government service?
Well, Ben, I'm glad you put it that way. I retired from government service because I'm amused when people see me and they say, gee, how do you like retirement? Well, I find out that getting into academia and all of the fun and the excitement of dealing with students, I'm in a different way, Ben, really quite busy. Not as crisis related as it was when I was at NIAID, which every day seemed to be another crisis. I still deal somewhat indirectly with crises, but very much different. And I think that maybe reflects why you say I look a bit more relaxed than you guys are used to seeing me back in the middle of the heyday of Ebola and Zika and COVID. But I'm enjoying it very much. I'm enjoying the difference. There's a great deal of difference being in the federal government as I was for more than 50 years, 54 years, and now being in an academic setting. They're both very gratifying, but they really are quite different.
Eric, thoughts from your side? Any advice you'd give Tony? Because, of course, you're sort of on the same track, an emeritus track.
No, I was just going to say that for me, the transition going for Tony giving out grants for many years, being on that side of the evaluation, looking at the ability of the grantee, the recipient of the grant, the principal investigators, to pull off the research needed, is now on the other side of that equation. It's a very different part of the elephant that you're looking at. So I found it took a couple of years to transition into that side of the equation. But the institution helped keep that reality front and center.
What are you enjoying most, Tony? I suppose it's not a question of applying for grants versus teaching and mentoring the next generation.
No, my arrangement with Georgetown is one that I think is beneficial to both of us. And I for the first year, I mean, I stepped out of the government in December 31st of 2022. So I've been at Georgetown since July of 2023. And I spent the first year post-government working on finishing and perfecting my memoir, because I had been thinking of and writing a memoir in the sense of the story of a life in public service, not something that's concentrated, as most people would think, on COVID and Trump and all that. That's not really what it is. A relatively small proportion, about 15 to 20% of it is that. The rest of it has a lot to do with what Eric and I were involved for most of our career. The 43 years we were involved with HIV/AIDS, and then the other things that we got involved with. So it's been very enjoyable, but intense. So that's one of the things I've been doing. The other thing that I've been doing, which has been a very pleasant surprise for me, is having a lot of daily interaction with students, at seminars, at fireside chats, coming to my office, getting career advice. Like a typical example, yesterday, I sat down with a group of about, 30 or 40 medical students, pre-meds and postdocs, just at Q&A, just asking any question that was on their mind. We spent well over an hour doing that, and it was really a lot of fun. So that's the part about it that I'm enjoying the most, that actually turned out to be a pleasant surprise, because I didn't think I would have that much fun with people, even at the undergraduate level, which is really, really a different experience than I had at the NIH.
And they must be so lucky, these young students, to spend time with you. That will be worth its weight in gold. But Tony, before we step back and see how you're feeling, you've had a chance perhaps to take stock of the last few years of your life. I know we wanted to just get your sense, your finger on the pulse, as it were, of what's going on, in terms of global health at the moment. It's a crazy time, isn't it? And Eric, over to you. I know you had some thoughts about PEPFAR and reauthorization.
Yeah, thanks, Ben. And I'm curious what Tony's thoughts are on this. The ability to kind of put program in country, the major motor that Tony really was instrumental in visualizing and implementing itself, is the PEPFAR program, bringing resources from federal government, USG, to partner countries in Africa, Sub-Saharan Africa, Southeast Asia, and Eastern Europe. This has been an extraordinary motor for identifying individuals who are HIV positive, putting them into staging, diagnostics, treatment, and initiating treatment for opportunistic infections if needed, but getting eventually on antiretroviral therapy for the duration and their life. That system has been reauthorized in 5-year reauthorization chunks, and this year, for the first time, was reauthorized in a 1-year reauthorization, which puts a challenge on planning, both short and long term, for both the USG program implementers on the USG side, as well as the implementing organizations in country, including the ministries of health. So just a overarching reaction to kind of that challenge, and how we might better position to get through it, to keep and preserve the program that we've already invested in.
Yeah, I mean, I am very troubled by the fact that the authorization is 1 instead of 5 years. I mean, if there was something, a rationale that made sense, like if there was a concern about the success of the program, you could see that you might want to not make a commitment for 5 years. But you have, which is I would say arguably, but it is unarguably the most impactful public health program ever initiated for a single disease in the history of public health. And the end of 2023, which was the 20-year anniversary when President Bush came to Washington with Laura and the original team that was involved, Josh Bolton and Gary Edson and Jay Lefkowitz and all the crew that was involved in helping put that together. And we evaluated what the impact was of that 20-year commitment, which was 20 years on a 5-year by 5-year by 5-year basis. We started off with 14 countries and $15 billion over 5 years. And now we had about 50 countries and $110 billion and saving 25 million lives. I can't think of a more successful program that I've ever implemented. So the thing that's absolutely mind-boggling about that is that we're not having an overwhelming enthusiasm on the part of the Congress on giving it a 5-year reauthorization with even more resources than are being asked for. So I just think it's a terrible reflection on the state of the interface between politics in its rawest sense and something as purely beneficial as the PEPFAR program. It's quite disturbing.
I guess if I could press you both on two parts of that response, Tony. I mean, the first is that, PEPFAR has actually been almost a selfless expression of solidarity from the American taxpayer. But it's also had a huge impact in terms of the broader security agenda, in terms of really enshrining a commitment to the countries that were our partners of PEPFAR. And as you see what's happening in the Sahel with the withdrawal of the French, the collapse of democratically elected governments, it seems to me bone-crushingly stupid that this example of soft power would not be prioritized. And maybe you can put that in the same bucket as support to Ukraine. But there is something particularly unique and valuable, self-interested value to the United States that I don't think is coming across. Is there any value in pressing that further? I mean, it's a question for both of you, really.
Let me take it first. I would say that PEPFAR is really the finest example of soft power between a bilateral relationship with countries over a 20-year period. It's not for a 1-year, 3-year, or 5-year, but for a sustained commitment and investment in the future. The United States has put 20 years of that kind of partnership with partner countries in these settings that would not have moved this agenda had they been left to their own resources. And I think it is a wonderful example of a resource-rich country being able to move resources to another country so that country's population benefits specifically from the interventions, and we are able to move, I hope, in the long run toward a more an investment in the primary care platform in general. The HIV investment we've made in HIV-positive individuals, needing to also acknowledge that now these same individuals are dying from hypertension, diabetes, coronary artery disease, and that the primary care platform needs to be response to the HIV-positive person as we move forward. That kind of, I think, solidification of the investment is something that we all would love, and I think looks at the pandemic threats that are there and the security threats that come with it as something that we have a global response, again, a soft power response with U.S. investment remaining intact.
Yeah, and there are so many other implications in addition to the points that Eric made. In a world where, in some respects, the United States is not always favorably looked upon, you go to Africa and you see the the influence that the Chinese are trying to have by the building of infrastructure and railroads and things like that. But you go to Africa now and they hear you from the United States, and more often than not, somebody's going to be thanking you for PEPFAR. I mean, that happens all the time now. Whenever any of us go to any of the Southern African countries that have benefited from PEPFAR, the appreciation of the goodwill of the American public, the American taxpayer, is really palpable when you come to those countries that have benefited. Also, something that I remember in the earlier years that Colin Powell mentioned to me and others about the whole idea of global and national security at a time when a country that is racked by a disease, insecurities of the ability of a government to function in a democratic way. And when you strengthen their health systems the way you do with PEPFAR, is not only good for the country, it is good for the entire global interaction of countries when you're dealing with countries that are secure economically, health-wise, and politically. When you have the kind of rampant disease that you have, there's a lot of insecurity there, which spills over into our own security. So there are so many, many, many reasons to have a continued robust support for this. As I said, and we all said here on this podcast, it's mind-numbing to think that there's not an overwhelming amount of enthusiasm to continue a long-range commitment to this program.
So my second question, which is a bit of a cheeky one, again for both of you, is around, I guess it's a truism these days that we're going to end AIDS as a public health threat by 2030. And Eric and I have had some fascinating conversations about this, mostly, frankly, a little bit depressing. But I'd love to put it to you both. Here we are, April 2024, 6 years away. Do you think we're going to end AIDS by 2030? Oh, for people listening to this, I so wish you could see Eric's and Tony's faces. That sort of, we don't need to say anything more about it.
I think, it is always a good thing to set goals that are concrete and real. But I think the complexity of getting to 2030 to end the epidemic would be a challenge that I don't think we'll meet, but I do think we will move towards it as we've done over the last 20 years. And I am not pessimistic about it. I still remain optimistic that this is still the focus and attention. I just think 2030 is too soon, but committed to it.
Yeah, one of the things we have to avoid, and that's one of the dangers of setting timelines, is that if you set a timeline that was set, that we all set and hoped for, was the ending it as an epidemic, a pandemic as we know it, by 2030, is that when you don't reach that goal, the one thing you don't want to do is throw your hands up and say, okay, we failed. Now let's concentrate on something else. I think the critical words that Eric mentioned a moment ago is that we are still moving towards that. We may not meet it, at the end of 2030, but we're going in the right direction, a bit more slowly. We have some bumps in the road, like the lack of a long-range commitment to PEPFAR that we've been discussing over the past several minutes, but there are a lot of reasons to be optimistic. And I think particularly the now well-proven efficacy of long-acting preparations, I think will make it much, much more likely that if we put an effort into it, we'll get a better implementation of PrEP programs. We all know that PrEP is being underutilized. Certainly it's underutilized all over. In the United States, people of lower income and minority populations are not getting as much PrEP, whether it's Truvada or injectable cabotegravir. It doesn't matter. They're not getting it. And we're seeing the same thing in the developing world. So if we can ratchet up the implementation, I think we can get closer to what Eric was referring to is moving in the right direction.
I think that is the best possible way of describing it. And the idea of setting artificial timelines, we're obsessed by it in the public health community, the global public health community. It doesn't always necessarily serve us, but that was a really helpful set of comments. Tony, Eric and I were wondering if we could also get your rear view mirror view now of COVID, and in particular, lessons learned, and how prepared you think we are for the next one.
Yeah, well, I think lessons learned is linked to your question. If we've learned the lessons, we will be better prepared. So there are some positive lessons and some lessons about some negative aspects. So let me explain. If you look at how we did, I tend to look at COVID both retrospectively as well as projecting for the future epidemics into two major buckets: the scientific bucket of preparedness and response and the public health bucket of preparedness and response. So if you look at the lesson learned, what we learned and shouldn't forget in a positive way is that the years, if not decades, of investment in basic and clinical biomedical research, both in platform technologies, test assess the mRNA platform, immunogen design, which goes back to HIV. If you look at the structure-based vaccine design that we have not successfully done with HIV, of getting the right envelope confirmation, that structure-based immunogen design allowed us to be able to get the stabilized spike protein in a pre-fusion form by people on HIV working with people with COVID, so that we did the almost impossible. We went from a sequence of a virus on the 10th of January of 2020 to less than 11 months later, having tested the vaccine in more than 30,000 people and showing it to be safe and effective and going into the arms of people at the end of November, the beginning of December. That was unimaginable. So that's a good lesson. The lesson that we hopefully will learn about how poorly we did was, at least in the United States, and I can't speak for the rest of the world, some have done better and some have done not so well, is the fragmentation of our public health system that did not allow a uniform response of being able to utilize known interventions to do things that we know were effective in preventing the spread of infection. And the other thing is that, as I've often said, I wrote a paper in the Journal of Infectious Disease on the 10 lessons from COVID. And one of them is that, if ever you didn't want to have a pandemic at any given time, it would be when you were in the middle of a degree of divisiveness within a country where you couldn't agree upon what was the best implementation. So there are so many other things. Misinformation and disinformation is the enemy of public health. One of the other things it pointed out is that whenever you have a pandemic, it sheds a very bright light on the disparities in society that lead to minorities, particularly African Americans, Hispanics, and Native Americans, for getting a much greater tendency towards getting severe disease based on lack of access, as well as the social determinants of health.
Yeah.
So there's one lesson after the other. So in answer to your question, I think we need to do much better in the public health arena, and we need to continue the support of the science, which allowed us to do things with regard to monoclonal antibodies, vaccines, and even therapeutics that would not have been imaginable years ago had we not had the support that we had.
Eric, over to you. I know you've got loads of questions for Tony.
Really, no, I would just say Tony's really outlined very nicely I really do think the bucket of public health response versus scientific advances that occurred. The COVID response was breathtaking for the coming together of years of research and commitment investment in platforms that allowed for a rapid orchestration to make answers and develop vaccines that were, as Tony said, going in arms within an 11-month period. Truly a remarkable feat, and lives were saved because of it. The investment in that effort was total, but I just want to re-emphasize the point that the decentralization of our healthcare system in the United States and in many places in Europe resulted in a stuttered reproducing elements of the rollout of the response in one city, state, and county after another in the United States. The same questions, the same answers, the same people convened repeatedly to move the agenda for an entire state. And that confusion, I think, is something we need to really work hard to make sure that when there's another pandemic threat, that the orchestration can occur across stovepipes of funding that only covers inpatient kind of services and doesn't look at itself as being a resource motor for the public health needs of that same population. Getting that straight is going to be important.
And I think both of you have spoken about from the public health side, the need to address misinformation, disinformation, build trust. And it's sort of no surprise, really, that we started doing a Shot in the Arm podcast, maybe just before COVID kicked off. And I remember doing a live event at the Commonwealth Club with Peter Piot and Heidi Larson, in, I think it was July 2019. How prepared are we for the next pandemic? And I think the conversations that, you have both had on the podcast have been hugely inspiring and helpful to audiences that have really sort of appeared around the world. And I'm not quite sure how that happens, but it's extraordinary to me to find that while I might never have been in a boy band, I have at least been able to get onto the Apple charts as it relates to podcasts in Nigeria and Kenya. Who knew? But really the idea that I think the three of us and that Eric and I have really worked on is to try and use long-form content, long-form communications through podcasts, like a Shot in the Arm, to try and bring the complexity, the nuance, and actually the humanity, the personality of the scientists and leaders involved to a broader audience. And I just wonder, Tony, how useful that as an exercise is and what advice you would give us for the next 10 years.
No, I think you outlined it perfectly well. I think this form of communication is absolutely essential. I think the short little sound bites back and forth don't have the impact of really having a discussion of getting correct information. I get asked this question all the time. There's so much misinformation and disinformation. What can we do about it? Well, I'm sure you're aware of the experience of you cannot stop somebody from spreading misinformation or disinformation. You run into the Mack truck of the First Amendment that even though somebody's saying something so preposterous that you can't really, at least without getting sued multiple times, try and prevent that. But what you can do is to get out as much correct information based on experience, individuals who are in the field every day, based on data, evidence, and information, to do that as much as you possibly can and as aggressively as you possibly can. And I think this format is a very good example of that. So when, we were talking about the students at Georgetown, they raised their hand. They ask that question all the time. What can we do about misinformation and disinformation? And the answer is to push back with correct information, because you can't throw up your hands in frustration. And, the people who spread false information, I think, it's almost as if they don't have a day job. I mean, all they do is spread false information. It's kind of like we're outgunned when we're trying to get information that has a basis in reality and in fact. So that's my wholehearted endorsement for what you guys are doing. We just got to keep it up.
Okay, another really cheeky request. Having said that we don't like short form content, Tony, any chance you might say something nice about a shot in the arm that we could use as a clip on Instagram?
Well, of course, no, I think a shot in the arm has a history now. When you first started, we knew it was good. I had the pleasure and the honor of being one of the first to be on the program. And it just warms my heart that years later, here we are again, enthusiastic about the subject matter and engaging in a really active dialogue. So, for those of you who have not been involved in listening to Shot in the Arm, you're missing something.
Thanks, Tony.
Eric, your reflections on why this engagement around long-form content podcasts is so important to you, because it's a real honor for me to be working with you so closely on this. But why is it important to you?
I think that an opportunity to hear and unpack the thinking that goes into a lot of kind of proclamations in both the scientific and especially in the public health arena, you need to have an opportunity to unpack the thinking and to do it in a thoughtful back and forth way. I think that's a critical complement to kind of a scientific presentation of data that supports the positions that we're talking about. I think that Tony's whole career has been aligned with that, as yours has as well. And I think that continued conveyor belt of data informing policy, informing program is something that I think we've all honored in our careers and want to continue to do so.
Super. Well, I know we're coming up to the top of the hour. There's one more thing, Tony, that Eric and I need to do. This short clip of this podcast is going to be played at the Show of Hope, the gala of the San Francisco Community Health Center, a really groundbreaking federally qualified health center that works in the tenderloin of San Francisco, focusing exclusively on providing a safety net to those that fall beneath the safety net. The CEO, Lance Toma, reminded me that during COVID, rather than shut its doors and go into hibernation and lockdown, the center actually expanded its work with street medicine. And in fact, it was one of the first, I think it was the first district, the Tenderloin, to reach over 90% full vaccination with the COVID vaccines, all because essentially of this kind of street outreach. And so it is a real honor for us to award you, on behalf of the center, the Global Health Champion Award. It's the second time it's been awarded. Your predecessor was Speaker Emerita Nancy Pelosi. But just a huge thank you from everyone at the San Francisco Community Health Center for your lifelong commitment to service, but particularly the support you gave us in the last few years in tackling COVID. I know, Eric, you've got some thoughts and questions that you'd also like to put to Tony about the role of his leadership and why the center is so honored to give this award.
Well, thanks, Ben. Well, the San Francisco Community Health Center is truly a frontline, talk is cheap, actions speak louder than words type of facility. And Dr. Fauci, you have been just that in my life and in the lives of all of us in the United States, from the early days of the HIV outbreak in the 80s through all of the pandemics, Zika, Ebola, as well as the COVID fiasco that we have just engaged with. And the wonderful thing about it is your commitment to service and your commitment to delivering a quality that is the same for wealthy, for poor, for black, for white, for yellow, for red. And I've seen that in you since your earliest years and have been really honored to walk with you along this path, Tony. You have always done the right thing because you believed in it and you had the moral conviction to deliver it. And that's a rare combination, but it's been a real pleasure. I'm thrilled that you're getting this award.
But thank you so much. I appreciate it. It's particularly meaningful to me because of the relationship we've had over all of these years and my great deal of affection for the city of San Francisco, where, I've almost feel like it's my adopted city.
It is. I've been given the keys more than once.
Thank you. Really, very, very much appreciated.
I wondered if you had any words of wisdom for our staff, our clients who are in the audience, our supporters, our friends.
My comment would be one of congratulations, and almost, in fact, not almost, but actually for a very long time being in awe of what you all do. I mean, Eric will tell you, going back now 4 decades or longer, right from the very beginning of HIV, whenever there was a need to do some bold actions of addressing a public health crisis, from the very early days of the stigma associated with HIV, to the care in the special wards at the San Francisco General Hospital, to how the community responded to homelessness and substance abuse, how you responded to getting communities. I mean, if you can do it in the Tenderloin and get everybody vaccinated, anybody can do it anywhere. So it's been that San Francisco has been the shining example of just being a leader in things that were generally thought to be very difficult, if not impossible. So my words to your colleagues there in that wonderful city is congratulations on what you've done, and continue to be the model for the rest of the country, if not the world, for what you've done.
Well said. I would just add, thank you for the work you do. Genuinely, you are part of the response, and you know that the role you play. And I just want to acknowledge the importance of that. Talk is cheap. Actions speak louder than words. Something I told Tony 30 years ago, that he really reflected that to the community in San Francisco as the Ryan White Care Act kind of spread that service capability to many other cities. So thank you for that work.
Thank you.
Well, terrific. I guess we really have reached the top of the hour. Tony, anything that we've missed that you think Eric and I ought to be focusing on going forward, or things that you feel our audiences around the world would value?
No, I think we covered it really very well, Ben. I just would say continue your great work. It's such a great model, and I think the people who are listening to our conversations perhaps might be inspired themselves to continue the work in their own well. So hopefully these types of discussion will have a multiplier effect of those who are listening.
Super. Well, Eric, do you want to close us out with Tony?
Well, just want to thank everybody for participating in this. All long roads begin with one foot in front of the other at the beginning of that march. And I feel like we've been doing that all along. So thank you so much.
Indeed.
Great. Well, that's it for this episode. Thank you again to my co-host, Eric Goosby, the nice one. Thanks to Tony Fauci, who yet again continues to inspire and enthuse, and is looking so young. It's fabulous. Thanks to Eric Aspera, our director and producer. Thanks also to you, our subscribers, viewers and listeners. If you haven't already, make sure you subscribe, give us 5 stars for both A Shot in the Arm podcast and the Global Health Diplomats. And we'll be back with you very shortly with more episodes. Have a great week and a safe week, everyone.